On the Health Watch, fewer people are dying from opioid overdoses in Illinois. That data coming from the State Department of Health, and it shows a 9.7% decline. That's the first drop we have seen since 2018. Joining me to talk about that, Dr. Julie Nowinski Konchak. She is an addiction medicine physician with Cook County Health. Doctor, thanks for being with us.
Thanks for having me, Marie.
So this is great news for the state at large. I'm curious if this trend also holds for Cook County.
Yes, you're right. So this is positive, very good news, reason for us to be optimistic across the state and locally here at Cook County. You're correct. The data demonstrates that we're seeing a decrease from 2022 to 2023 data, and that holds true for Cook County as well. We should take this as that we're step in the right direction, no patting ourselves on the back, so much work remains. These numbers still are higher than pre-COVID.
Sure, but encouraging nonetheless. I do want to focus on that because you need that in such a tough battle out there. What do you think specifically is making the difference in reducing these opioid deaths across the state and in Cook County?
Sure. So likely very multifactorial, lots going on. I'll give you a couple examples, though, of tried and true public health measures. So community-based intervention, so street outreach, meeting people where they're at, and there's incredible community partners doing this across Illinois and certainly in Cook County. Cook County Health just recently funded 53 organizations on the ground with $44 million through behavioral health grants with the Stronger Together initiative to bolster this work and others. We're seeing an emphasis on the upstream pillars of housing and employment and opportunities to be healthy in your community. We're seeing a lot of increases in access to evidence-based treatment, such as medications. I'm sure many have heard of methadone, buprenorphine, for example. We're proud of that here at Cook County Health. We have all of our primary care health centers, our hospitals, our EDs, the ability for people to access these medications, which are life-saving treatments for opioid use disorder, and then the recovery support services, the behavioral health services that that person is looking for. So all of these things, naloxone, of course, access to naloxone has increased locally and across the state. The state, we appreciate our state partners that have really led nationally on making naloxone available and accessible. Here at Cook County Health, we're really proud to have vending machines in both Providence and Stroger Hospital waiting rooms, as well as our core center, and then distribution boxes in our health centers, and more to come in that way. But making the right thing to do, which is the easy thing to do, is the way that we approach this. And the right thing to do is having naloxone available and accessible and reaching everyone who can intervene in the events of an overdose.
Right. I think getting people familiar with it who can help in an emergency is such a key part, so we're glad to hear that that's working well. Dr. Julie Nowinski Konchak, thank you so much for your time and for talking with us about this.
Thanks for having me.